What we'll work on now is pelvic tilting. I'm going to take a fairly simple exercise and break it up into parts to make it easier to understand. To do that, I really need to discuss the abdominals. There's several layers to the abdominals, and the deepest muscles are the pelvic floor and the transverse abdominis. The pelvic floor is basically the muscle. If you come from your belly button, the first bone down is your pubic bone, and the pelvic floor muscles go between your pubic bone in the front, sits bones, the bones that you sit on either side, and the tailbone in the back. So you use these muscles to stop your urinary flow. And so if you wanted to, it's also called a Kegel. The Kegel is an exercise that draws the sits bones together, so we're narrowing our pelvis. And it works with the transverse abdominis, which is the muscle, the safety belt muscle that helps draw the belly in. The next layer of muscle are the obliques. The muscle will, one will turn your body, so they rotate your spine, but in conjunction, they'll help connect your rib cage to your pelvis. And then we're all familiar with the six-pack, the ones that everybody likes to do crunches. But that really doesn't support the spine as well as the deeper muscles, because they help create length and more support to the spine and don't cause compression. So what we're going to do is try to start with strengthening those muscles, those deep abdominals, the pelvic floor and the transverse abdominis, with a pelvic tilt exercise. And if we use the inner thigh, it helps you to feel that pulling the sits bones together a little bit. So I'm going to have Monique take a breath in through her nose, use her diaphragmatic breathing, and squeeze the legs together and try to draw the sits bones together. And if you look closely, you'll actually see the thigh bones coming a little closer together as she does that. So relax, inhale, squeeze the ball, pull the pelvic floor up, and relax. Then we can try to use the muscles on top of that, the transverse abdominis and the obliques, to actually move the spine from what is a little slightly arched position to a flattened position. One way we can consider this is pretend that there's a compass on your belly. The north is up here, the south is up here. We're trying to tip the compass towards the north. And then as she releases the tension in her abdominals, the tension in the back of the spine will tend to draw her tailbone back south into that more arched position. So if we try to coordinate everything, it would be a breath in through the nose, exhale, squeezing the legs, drawing the navel to spine, and trying to roll that pelvis back and flatten down. Now I'm going to actually place your knees in a more flexed position, because if there's a little more mobility in the pelvis, she'll be better able to feel that movement, and we'll be better able to see it. Okay, so take a breath in through the nose, squeeze that ball, do your Kegel, and there she goes, right back into a flat spine. And then inhale, exhale, just softly release those abdominals, and she came back to her arched position. Inhale, exhale, inner thigh squeeze, roll that pelvis back. See if you can hold that for 5 seconds. 1, 2, 3, 4, 5, and slowly release. Good. Inhale, exhale, squeeze, and roll back. And it's nice to start with about 5-second holds to help train the strength of these core muscles. Inhale, exhale, squeeze, roll back, hold, 2, 3, 4, 5,